it was much more passive on the psychotherapist's part. So the patient would do all the talking, the psychotherapist would just listen, and every once in a while they'd interject something like, well, how did that make you feel? Or something, you hear that all the time. So they might do that, or they might, they pop in some observation, but very passive. They didn't do a whole lot of work in the session. It was mostly the patient doing the work. With cognitive behavioral therapy, again, still a lot of the patient doing the work, but it's very much a regimented type of therapy. So I guess the best way to explain it is to give you examples, maybe. That's the best way. Cognitive obviously means thought, and behavioral means behavior therapy. So it's basically changing your thoughts and your behaviors with the idea that if you change your thoughts and behaviors, it'll change your mood or your anxiety. And they've done it now. They've shown it to be effective even in schizophrenia.
Yeah, but combined with medication for some.
For anxiety, it is the treatment of choice. Yeah, if you have panic disorder, social phobia, generalized anxiety disorder, post-traumatic stress disorder, cognitive behavioral therapy with medication is the treatment of choice. I mean, hands down. The medication works in the short run, and the cognitive behavioral therapy works in the long run, and people that do the cognitive behavioral therapy and stick with it, they stay better longer. With the idea that if you change your thoughts and behaviors, it'll change your mood or your anxiety. And they've done it now. They've shown it to be effective even in schizophrenia.
Yeah, but combined with medication for some.
For anxiety, it is the treatment of choice. Yeah, if you have panic disorder, social phobia, generalized anxiety disorder, post-traumatic stress disorder, cognitive behavioral therapy with medication is the treatment of choice. I mean, hands down. The medication works in the short run, and the cognitive behavioral therapy works in the long run, and people that do the cognitive behavioral therapy and stick with it, they stay better longer than people that just do medicine alone. Cognitive behavioral therapy then, so let me think of a good example. Let's use depression, I guess, it's the first thing that came to mind. So depression, what happens when you're depressed? Is anybody, you get really negative. And so the thoughts you have are very negative. It's things like, geez, I can't do anything right. Everybody hates me. Nobody cares about me. These are called automatic negative thoughts. Okay, in cognitive behavioral therapy, they call them automatic negative thoughts. They pop into your head. You probably don't even realize you have them, but you are having them. In cognitive behavioral therapy, they would challenge you. The therapist would sit down with you and say, I want you to keep a thought record. And a thought record would be, usually the first thing you notice typically is not the thought, but it's some feeling. You all of a sudden get very depressed. Then, so what it'll say is, okay, emotion on one side. It'll have mood. You'll say depressed. And it'll have your rating out of 10. It's 10. It's the worst that it can be. The next thing is, what's the thought that went with it? And sometimes that's hard for patients. But eventually they come up to, or sometimes, they'll have a situation. What was the situation that happened? And then what was the thought that you had about that situation? So maybe the person has, let's think of an example of something that might happen to somebody. They go through a checkout in a supermarket, let's say. The person treats them very rudely, okay? So they come out of that checkout, well, even that person who doesn't even know me thinks I'm worthless. That's the thought, I'm worthless, based on the situation of that checkout lady treating me bad. So the psychotherapist would then ask the patient, I want you to challenge that for a second. I want you to stop and think rationally about that. Is it likely that that person even knows you from Adam? And they really challenge them to think about what's the likelihood that these things are true that you're thinking, that you really are worthless. And they would do things like, so even if the cashier thought you were worthless, who is the cashier? Is she God? Is she ultimate judge of you? What do your parents think? What does your spouse think? What do your kids think? They all think you're worthless? And typically the person's like, well, okay, they say they don't, and all these things. And then by the end, after you have them go through this process of thinking through all these steps, at the end you have them rate their mood again. And invariably it usually drops down. It's usually a little better than it was. And you do the same kind of thing with anxiety. There's different types of, let's say with OCD, obsessive compulsive disorder. You do a type of cognitive behavioral therapy. It's called exposure and response prevention. So if they're fearful of contamination with germs, You have them go in and you have them, you work up to, you don't usually have them just go right and do it, but have them work up to touching a toilet seat or a toilet rim, okay? And because let's say their obsession is, of course, the germs, you know, and they don't want to touch anything, you know, let alone a toilet seat. They wouldn't even touch a door handle or the chair or anything. So usually the thing that they would do is they would wash their hands compulsively over and over and over again after they touched something they thought was dirty. And the idea is then you work them up to touching something dirty, but don't let them wash their hands. And what happens is you expose them to what they're so afraid of, and force them to see that they didn't die, that nothing bad happened, despite not washing their hands. That's another type of cognitive behavioral therapy, and you know it's extremely effective. But people don't like to do it. Why? Because, well, first of all, it's hard to find people the therapists that'll do it with you. But it's also hard because people don't want to do something that takes a lot of work, right? Well, it's much easier to take a pill if you can take a pill. But the pills work fine, but they're not near. I mean, if you do both things, it's the best, as you can imagine, right? I mean, if you behaviorally expose yourself to something over and over again, and you see that nothing bad is going to happen, it's like fear of flying. It's like any fear. If you expose yourself over and over again to it, eventually the fear goes away because nothing bad happens. No longer are you afraid of what might happen because you've done it and nothing happened. So, that going forward in the long run is the best. It's really good treatment, but it's again difficult to find. So does that answer the question? That's a long answer, wasn't it? So that's just actually one type of psychotherapy. It tends to be a really well-studied type. I mean, they've studied it in all different types of illnesses, and it's been very effective. So, okay. So the next question I have is are all psychiatrists like Freud, practicing psychoanalysis and having you lie down while they analyze you? Obviously, like I said, that's unusual. It's not done much anymore. There are certainly psychoanalysts out there that still treat folks. Personally, I think anytime you stick with one particular type of treatment and you try to fit that to every single patient, that's probably naive. That's probably not going to work. So I think the best psychotherapists actually are flexible enough to know when CBT is going to work for someone versus psychoanalysis versus different types of psychotherapy, okay? So there are still some folks that do psychoanalysis, but not as much. And in the old days, you'd go to see a psychiatrist, and they would do everything. They would do the psychotherapy and the medication. And personally, I sort of wish that still was the case, because who better to do your medicines than somebody that knows everything about you, that knows the core you. If the psychiatrist, if all the psychiatrist has is 10 or 15 minutes to see you and ask, are you having side effects from your medicine? Okay, let's refill this. I mean, that's not enough, And I'm going to give you a real world example here in a second, but the reason it's kind of gone this way is, the third-party payers, the insurance companies, Medicare, Medicaid. Obviously, I mean, they're in it to try to save money. They want to save money, so they want to pay the least for a service that they can. So if you'll notice, what's happening is you don't see them paying physicians as much. They'll pay physicians sometimes, but a lot of times you'll have nurse practitioners, clinical nurse specialists, and now doing psychotherapy, you have social workers. You're not even psychologists, but social workers now doing psychotherapy. These people sometimes are excellent at what they do, so I'm not taking away from what they do. They're well trained and they're very good at what they do, and I worked with a lot of them where I was. But I just think that the biggest piece that's missing is the coordination, especially if you're not in the same clinic. If I'm seeing somebody for medicines and a therapist across town is seeing them, realistically, how often I'm not going to be able to call them all the time and run the patient by them and see how it's going. Usually it's only going to happen if something bad is happening or something's going wrong. But I think, getting away, that's called a split treatment model is what that's called, where this treatment is split between two people. And it's not always the best thing. I mean, think about it with regular medicine, right? How hard is it for your family doctor to keep track of all the specialists that you see? That's difficult. I mean, they do the best they can, but it's difficult to do that. Now, what did Dr. X start you on yesterday? And what labs did Dr. Y do on you last week? And that's difficult to keep up with, especially in this day and age. Eventually, maybe things will be on the internet, and you'll be able to type in your Mrs. Smith, and boom, all of the labs and all the meds and everything is all in one system that all doctors can access. But at this point, we're not there. So with this split treatment